Hey guys, I am back with the last lecture on the immune system. So this is immune system 2. Okay. All right, so fill in the blanks. Acquired immunity. The immune system can acquire immunity in 2 different ways. So basically, in active immunity, the immune system produces the antibodies itself. Meaning that after you've been exposed to a virus, bacteria, something like that, your immune system is responding to your own personal exposure to that, okay? When your body produces its own, that's called active immunity, and it is a long-lasting what do I say? It's a long-lasting result in that your body remembers it longer. Okay, we talked about vaccines in the immune system 1 lecture, and about how you're giving your immune system a jump on identifying pathogens. And this is how it works. It's by helping your own immune system produce antibodies to that. It's an active immunity process. In passive immunity, we talked a little bit about it too when we talked about giving antibodies, like injecting them into somebody that's sick, because it's taking time for their immune system to ramp up. So in passive immunity, then, the person is given the antibodies. Their own body has not produced them. And so the effects are temporary, right? Because it's not something that your body has made, so your body's not going to remember as long. Examples, the placenta in utero, breast milk, when mom's feeding, they get some antibodies from mom, and then of course the antibody injections. Okay, all right. When cytotoxic T cells are killer Ts, or antibodies mistakenly attack the body's own cells, the person has an autoimmune disease. There's lots of different types of autoimmune disorders now, more being discovered. The exact cause isn't 100% known. There's some where they know what the trigger is, but not necessarily why it's happening. So kind of a tough field, and definitely tough to be dealing with as a person. Because like I said, it's not known. There's one type of autoimmune disease called rheumatoid arthritis, or RA. The joints become inflamed, and as the inflammation continues, the body starts attacking the area and the tissues around the joints, and it can cause severe disfiguration around, especially like the hands. This is an example of that, although I believe that osteoarthritis can have a similar effect, but regardless, RA. It also causes intense fatigue. It causes just generalized like body aches. It's somewhat similar in symptoms to fibromyalgia, not completely, but somewhat. And then there's different antibody markers that they like to look for in blood tests to help identify. But being able to diagnose an autoimmune disorder is also kind of difficult because a lot of them have similar results in the blood work. Things like lupus tend to be a little bit more in your face when it comes to blood work results, but a lot of these other ones, fibromyalgia, RA, there's a couple others, kind of hard to tell. And so then they're trying to diagnose based off of symptoms rather than just blood work. Okay. So RA has more symptoms than just this. And then lupus is mentioned here, including some of the things. The hard part with lupus too, which it's also not really talking about here or apparently in the book, is that lupus can shut down entire organs. It attacks organs and can shut down organs and organ systems. It's gnarly. Okay. Active immunity. We kind of did a little bit of this in the pre-lecture, but let's go over it in a little bit more detail. Move that out of the way first. So an active immunity, again, your body produces its own antibodies. It's made in response to an antigen, and it's facilitated, of course, by our B and T cells, because they're going to remember this infection. That's why active immunity lasts longer. Okay. And I kind of feel like this is a repeat, but it occurs after an infection or after vaccination. When it comes to infections, it's possible for somebody to have the pathogen, the virus in the body, but they're asymptomatic, which you're seeing a lot with COVID right now. It appears that the O blood type tends to be rather asymptomatic. But despite that, the immune system is still recognizing the pathogen and generally still ramping up to destroy it. So there would still be memory of the infection, even though you didn't feel like you were actively sick. Okay. So what would a vaccine be made of? I have an image on here that you guys don't. Anyway, basically, from what you have learned so far in the past lectures about antibodies and antigens and the immune system, what would you think is in a vaccine? I actually talked a little bit about it yesterday. By yesterday, I mean in immune system 1. All right, so vaccines tend to be made out of either dead or weakened virus particles, okay? Specifically, the parts of the virus that the immune system would identify, so the antigens. Those are put in a mix with binders, things that kind of hold it all together, and then injected into the body. There are some, well, actually, let's do the flu shot. Let's talk about flu vaccinations. So you have the option usually to either get an injection, the flu shot, or you can do the mist, right? The mist tends to make you feel worse. And that's because in the mist, you have a live attenuated virus. In other words, the virus is not completely dead, but it's been weakened. And so your body responds more strongly to it as far as the immune response, so that it lasts, the protection lasts even longer than the injection for the flu shot. The downside is you feel pretty crappy for a few days, okay? A lot of people that do the mist either take a day off of work right before the weekend or do it right over the weekend, so that they can kind of have essentially a mild case of the flu for a couple of days, and then they feel better, okay? The shot, at least most of the flu shots that we get, tend to be made of virus particles that are dead. You still get an immune response. It's still active immunity, but it doesn't have as long an effect as the mist does. There you go. Okay, so I've already said most of this, but again, vaccines exposes the immune system to the antigen to generate memory B and T cells, so they can be on the lookout for it if you encounter it in the real world. The first exposure leads to a small increase. So this is the vaccine. small increase in antibodies. And again, because you're getting usually dead or very weak versions of the virus, you don't have a totally ramped up immune response because you're not getting the whole whammy of the infection. You're just kind of getting a little bit of the sample, enough for your body to recognize it. So you get a small increase in the antibodies, and it's short-lived. Here's where boosters come from. And I talked about boosters in Immune 1 as well, talking about the fact that some vaccines have to be repeated. Some of it is because you have to remind the immune system. But for others, well, it's still because the immune system has to be reminded. But also because we need to kind of tell the immune system, hey, we're really serious. Like, don't just kind of be like, yeah, I'll watch for this infection. You need to be like, okay, I'm on it. So the second exposure or the booster shot creates that type of response. The response is longer. You get a larger number of antibodies, and it really puts the B and T cells on alert. It also helps the immune system to respond faster, again, when it encounters the pathogen in real life. Okay? So this little graph is just showing us what's happening with a vaccination. You have your first exposure, and this is the antibody concentration over here. They're just doing it from low to high, and then they're doing days. So it looks like actually you get your first vaccination it's kind of peaked a little bit before day 30, and it starts to decrease. Your body's like, all right, nothing happened. We're just gonna chill out now. By the time you hit your booster, which typically most vaccines have a time period that you need to get the booster in. It's like it can't be sooner than this many days, but it shouldn't be later than this many. So at this one, they're showing that a booster is received at day 60. The second exposure, the immune system quickly ramps up, produces way more antibodies, and as you notice, the peak and the high is going to last longer and stay higher the second time around than it did with the first. Okay. This is a sample vaccine schedule. Let me move this out of the way so I can see all of it. So vaccinations are given during all stages of life. Some vaccines eventually wear off. The booster, again, the reminder. Tetanus is a really common one to need a reminder for, the tetanus shot. And they've changed the number of years that they suggest it now. Is it 8 years? 10 for an adult? I don't quite remember. It seems like it's somewhere in the 8 to 10 year range. Some of the things that are included, I'm going to look at mine so that I can see it larger because the print on this is really small. Some of the things included for children or recommended children vaccinations: hepatitis, rotavirus, which is something that usually causes diarrhea-like type symptoms, diphtheria, tetanus, pertussis, that's called well, here it says DTaP, but some people, it's also called a Tdap. Of course, influenza B, pneumonia, polio, other types of influenzas, the MMR, the mumps, measles, and rubella, varicella, which is the chickenpox, hepatitis A, meningitis, HPV. Yeah. And then, of course, if you look at the chart, you can see that there are recommended age ranges where kids will get this, or that they're recommended that they get this. You have quite a bit in the first couple of years, and then it kind of lengthens and there's fewer required. For you guys, most of you have probably had the vaccine that prevents chickenpox, and thereby also prevents shingles, which is kind of a, how would I explain that? It's like a second phase chickenpox, because the virus for chickenpox stays in your body, but it's latent, so it kind of hibernates. And then if the conditions are right, which generally are a mix of stress and other health issues, it can turn into shingles. So you don't get chickenpox again. You get a modified rash, and then usually intense pain because it centers over a nerve and it picks one. A lot of people get it in their face. And so the initial onset has quite an impressive rash, which is very painful and miserable. And then the pain comes after, or sometimes during the rash. Anyway, I had chickenpox as a kid because they didn't have the vaccine for it. I know, Stone Age, right? They didn't have the vaccine for it when I was a kid in the 80s. So I had chickenpox, and I've also been lucky enough to have shingles. So fun. That was pregnancy with my second child. Good times. Anyway. But yeah, so there's stuff that you guys have vaccinations for that I didn't, that I just suffered through. And then of course, there's a ton more that I had that my parents did not. Like the polio vaccine came out after my parents' time. And so when they were kids, like polio was terrifying. What we're dealing with COVID, it was pretty intense with polio too, because it was just fatal in most cases, and you had to live in an iron lung. Vaccinations for adults, I can read this one easier. Flu vaccine, Tdap, varicella. You can get the shingles vaccine today, but again, it kind of depends on your medical history. HPV, shingles is going to be modified varicella, MMR. Most of this stuff is if you haven't had them as kids or if you've had a new exposure. Meningitis, hepatitis A and B, and we're looking at different types of influenza. So you've got just regular influenza, but you have influenza B. A and B are the ones that make you really sick, that are usually covered in a flu shot. What's not on here are some of the other vaccines that sometimes get added into the mix. Eventually they'll add in a COVID vaccine. When the swine flu came out, they started adding in strains of the swine flu, that specific influenza. They mixed it into the flu shot, which I believe they're still doing every year. So it changes. Okay, here's the diagram that I wanted you to see that I have on a different page. Why does it take so long to develop a vaccine? Obviously relevant considering the fact that we've been dealing with COVID in the States, but especially worldwide for about a year. Long story short, it's because there's a lot of red tape. Obviously, we want to make sure that the vaccine works, first off, and second, that it doesn't have any negative side effects like killing you. That would be unfortunate. Good news is we cured your pneumonia. Bad news is you're dead, but maybe that's why you're cured. So it takes a while. You get your volunteers, goes through the list of questions that are listed there. As long as things are moving along favorably, you move into phase 2 where you have a lot of volunteers. And you have a bigger pool, test pool, subject pool, to see if numerically, mathematically, if it's better than the vaccine that's out there, if there's a current one, and if it is helping more people than it's not. Because if you have a vaccine that's like, it helps 40% of the people, that's probably a go back to the drawing board, right? Phase 3, you get hundreds or thousands of volunteers, and some of the things they go through here, again, being able to have a larger test group, knowing how many people actually die? How many people actually have these severe complications that come from it? It has to be below a certain number for it to then be approved by the FDA. Then, depending on what the vaccine is for, usually it's released in stages. Like for COVID, it'll probably go to frontline workers first, which is usually people in medicine and some of the other frontline positions. Then it starts to trickle down through the rest of the population. Okay? Passive immunity, which is adaptive immunity. Again, this is where antibodies are given directly. And again, these are temporary or have a temporary lifespan because these antibodies will break down. And since your body isn't actively making them, they're not going to be replaced. Antibodies pass to offspring through placenta and breast milk. We talked about that a little bit. Antibody injections. So this is some of the reasons why you could be given an antibody injection. I've talked about one, if you get something that could potentially kill you before your immune system can ramp up or can make you very, very sick, you can be given an antibody injection to help your body fight it. And this can happen with COVID. That's one of the things that they're using. But also if you're a healthcare worker and have had accidental exposure to something. And this can happen through all kinds of different ways, but if a used needle goes through a glove, or if you end up getting body fluids on you, despite all your protective layers, stuff like that. So rather than wait to see if you get it, you can be given an antibody injection to just make sure that you don't. And again, these antibodies come from somebody that's already had it. In some cases, it can even come from an animal. In fact, the first type of vaccination for smallpox came from, well, how do I put it? Okay, so you ready for this? Milkmaids were what they sounded like. They would milk the cows and bring the milk in. Cows can get a version of smallpox. They're called cowpox. What the doctors found at the time was that women, so it was usually women doing this job, that had come down with cowpox, which if I remember correctly was kind of like the hands of breakout, they didn't get smallpox. And so people began to be vaccinated or inoculated with cowpox because it kept them from getting smallpox. So it is possible to get some antibodies from animals that either have a same or very closely related disease. Okay. Cytotoxic T cells. We talked about this with immunotherapy. They can be manufactured in a lab setting so that they are taught or programmed to find and destroy cancer cells. Okay. Okay. Hypersensitivity reactions. Okay, so instances where the immune system responds to harm the body. We've already talked about some of the autoimmune disorders, but there's others like allergies. With allergies, especially in, I'll wait till I get to the allergies part. Another one is tissue rejection, like in transplantation. And then we already did autoimmune disorders. All right, so allergies. You can be allergic to things like pet hair, pollen, food, okay? All kinds of things. I mean, if you can call it interesting, which I do, when you have a severe allergic reaction, you're exposed to an allergen and your immune system instantly ramps up like, that thing that we don't like is in here. So it rushes to try to eliminate it. The problem is when it rushes to try to eliminate it, remember the histamine response that gets released by damaged tissues or by mast cells, that it calls in more blood? Everybody over here, oh my gosh. It's like your immune system freaks out and calls in everybody it can get. Pretty soon, it's really crowded there, like really crowded. And that crowding causes swelling, and then you get the redness and all of that. But the swelling, especially if it happens through the throat, down the throat, actually swells the tissues closed. This is a problem because then you're not breathing, okay? It's actually the body's response to the allergen that causes problems for the body. If the body would just chill when it sees the allergen and not go so insanely overboard to destroy it, you wouldn't have, these life-threatening allergy type issues. So that's why if you are severely allergic to something, like to the point that your throat can close, they recommend you carry an EpiPen so that you can reverse that process. It basically makes the histamine reaction chill the heck out. It can have its own adverse effects, so after you use an EpiPen, you generally need to be seen at the ER anyway. Yeah, stuff like Benadryl, Claritin, Zyrtec, all of those help to prevent the histamine reaction from getting out of control. I don't know if it was you guys I tried to show a picture to, or if it was my other class, but my son got stung by a freaking enormous wasp a couple days ago here in Texas because, as one person put it, Texas is the Australia of the United States, meaning everything is freaking huge and deadly. Anyway, big old, like 1.5 inch long wasp, which I later found out is a paper wasp, gnarly freaking looking thing. Yeah, my son has actually not ever been stung before, and he's 13, and so I'm allergic. Like, so far, I've just hyped up really bad, but you never know when an allergy will turn fatal. That's right, folks. Another little tidbit. You can be not allergic to cats for 30 years of your life, and then all of a sudden, you're allergic to cats, okay? It's a bunch of environmental factors that react with your body as you age, or frankly, stress is a huge thing that can cause that. I digress. Because I'm quite allergic, I'm not sure if my son would have been, so I gave him a Benadryl, like an entire Benadryl, because that's a good thing to prevent a severe allergic reaction if you have it with you. Of course, it also kind of knocked him out for the rest of the day. Added bonus. Not really. Okay, yes, really. He's 13, and I love him dearly, but sometimes he talks a lot. Anyway, but those types of drugs can help with the histamine reaction. Don't tell me I'm mean for thinking my son talks a lot, because if you don't have kids yet, one day you'll have kids and they'll talk a lot. And you'll really just be desperate to have just like 30 seconds of silence. You guys hear the background noise in my house? You hear it? It's crazy. I just need like 30 seconds. Okay. antibodies on mast cell surfaces binds to the allergen and causes the release of histamines. Speaking of noise, there it all is. This leads to, as we know, the capillaries letting white blood cells come in and out, calls in the backup, and it also causes an increase in mucus production. And then it can just cause general irritation. You get the watery eyes and a runny nose. You get a sore throat from the drainage. All of these lovely allergy symptoms. And of course, with COVID, a lot of allergy symptoms, at least if they get obnoxious, mirror COVID symptoms. Good times. Is it just allergies or do I have COVID? Question of the year. That's the question of 2020. Is it just allergies or is it COVID? Asthma attack. Asthma attack is when you have this massive release of histamine in the airways, and of course the body's response, freaking out. Everybody get over here right now. It causes the airways to constrict and you can't breathe, and if not treated quickly, usually with an inhaled steroid, it can be fatal. Okay. All right. Now we have anaphylactic shock, which is essentially the super severe version of the allergic reaction. What I was telling you about, where the body freaks out so much that it kind of starts to shut everything down, and you have to tend to reverse that effect. So since I've kind of already gone over it, I'm going to just fill this out real quick. So I talked about food allergies, pet allergies. I'm not going to write allergies every time. Food allergies, pet allergies, bee stings, meds. Like, I am crazy allergic to penicillin. I also break out in massive, terrible hives when I'm exposed to penicillin or amoxicillin or most of the psyllin family. So the causes of anaphylactic shock. Okay. BP, blood pressure. I didn't write it all out. The EpiPen, the epi comes from epinephrine, which is what it's filled with. Essentially, it's adrenaline. And its job is to reverse the effects of what's happening in anaphylactic shock. So it's going to force those arteries to constrict to bring the blood pressure back up. Arterial, sorry. Okay. And it forces those, it reverses some of the swelling so that the tissues can relax and the airways can open. Uh, Again, people that have had to use EpiPen usually have to go to the ER anyway because you're getting this, well, hello, giant fly, go away. I'm telling you, not even 30 seconds. Even the fly is in here. Because when you get that much epinephrine into your system all at once, it can kind of swing you back the other direction where your pulse goes, can go crazy. Heart starts to beat really, really fast. Blood pressure can go quite a bit up. So you generally need to be watched after that too, just to make sure that your pulse can, heart rate can stay under control. Tissue rejection. Remember we talked about cells being marked with name tags. I belong to Kelsey or whoever, right? Because of that, if you're the recipient of an organ transplant or tissue transplant, you're getting somebody else's tissue that has their name on it. And so it gets put into your body and your body's like, that's not mine, and tries to destroy it, okay? Kidney, heart, liver, bone marrow, tissue grafts, like skin grafts, blood, we talked about that. Again, the foreign organ triggers the immune response. You're not mine. The T cells do what T cells do because they're awesome. They're the killer assassin T cells, and they come in to try to destroy it. One of the ways to reduce that is to do organ matches. So you try to find, oh geez, how many is it now? Is it a 10-point match? Is it 20? Anybody out there know? 12? They try to find a donor that has as many antigens in common as they can, so that you and your donor match with as many antigens as possible. Doing that means that your body is less likely to attack it because it's similar enough that it's like, hey, maybe that's kind of ours. Usually it's still required to be put on immunosuppressive drugs to keep the immune system from freaking out anyway, okay? It used to be like 5-point matches back in the day. Then I feel like it went up to 8 and then 10 and then 12. I feel like it's higher now because they keep finding more and more efficient ways and more antigens to match for to help prevent tissue and organ rejection without the intense course of antibiotics. You still need them, or immunosuppressants. You still need them, but it reduces the amount or the likelihood of rejection even with those drugs. The more antigens you match for, the more likely it is to hold. The lower the match, the more you're probably going to be fighting rejection. Immunosuppressive drugs like cyclosporin, and I'm actually not familiar with that one, tacrolimus. I don't even know if I'm saying that one right, to be honest. These, again, suppress the immune system to the point that it doesn't have the power necessary to destroy the organ. Obviously, this is still going to cause other issues in that with a suppressed immune system, you're really susceptible to anything and everything that comes along. Any type of cold, flu, it's a big deal. These are going to inhibit our T cell cloning. What did I just write there? T cell. Go away. Okay. So we don't have any cytotoxic Ts or much lower numbers of them. Again, to keep the immune system from having the strength to destroy. Xenotransplantation. This is where it comes from an animal. We already have different types of animal tissue transplantation, including valves for hearts. Pigs are actually a really good source for xenotransplantation. to the point that we even have the ability to genetically engineer them so that some organs don't have any antigens at all, which means there's nothing there to react with. Like with O blood, remember how there's no antigens on the surface? If they're not there, if it doesn't have a name tag, the body's not as likely to freak out about it. Some other things that are being looked at with transplantation, of course, is 3D printing of organs. And then being able to harvest stem cells, which is going to be way more controversial, normally because of where true stem cells come from, which is newborns, aborted fetuses, things like that, which there's all kinds of rules and regulations about. But like when I had my kids, they asked if I wanted to bank their cord blood, because should my child need a transplant or something down the line, it could be possible to take some of those stem cells and essentially grow a new organ out of their own cells. So the new organ would have their name tag on it already because it would come from their undifferentiated stem cells. So there's a lot of research with stem cells and transplantation. Okay, we finished that. Immunology and the immune system and epidemiology, it's one of my favorite branches of science and of biology. I mean, I say that about genetics. I say that about evolution. Dang, I have a lot of favorites. But this really is one of my favorites. I think it's fascinating how the body responds. And yeah, if you're interested in it too, email me. I can give you some links to some cool articles to read, or just go down the rabbit hole and read up on some of it yourself, because it's fascinating, and especially in light of everything that's happening with COVID right now. And there is so much insane information that is being publicized and broadcast, and so much of it is just not true. It's not how the immune system works. It's not how viruses work. So the more you can educate yourself, even with some general background knowledge, the better set you're going to be to deal with things like COVID and other stuff that comes along. All right. If you have questions, as always, please let me know. Otherwise, have a good rest of your day, week, whatever it is when you're watching this. Talk to you soon.